and welcome to The Kidney Bean, Confessions of the Chronically Chill. This is our podcast. My name is Tiffany, and I'm with my sister Samantha Arsu. And Samantha is a renal failure patient. Is that right? I don't even know if I should say it like that.
That's right.
Okay. So Samantha, when she was 22, and she's 38 now, and I don't math, has...
I'm not 38 yet.
You will be. In May. Has, you first got sick at 22. I do remember that. I'll let you talk about that. And you've been on dialysis for a couple years after that, got a kidney, and then for about 7 years. Mm-hmm. And then that failed, and now we're back on dialysis, and you're doing it at home. Is that correct?
Yes.
Okay.
I think after I introduce you, I'll get into that.
Absolutely. There's not much to introduce about me.
Yes, there is. There's a whole
Did
bunch.
you make a list?
I did.
Oh.
It's not bulleted, but basically. That's my sister, Tiffany.
Older?
Yes, she's almost 40. So for me, the way I look at Tiffany, obviously sister first, but now mother first. And
some would say a certain kind of mother, but...
No, a great mother. A great mother. Wifey, we'll just give it that title because it's not technical. Tiffany's the force behind this podcast. She got everything moving, so I really appreciate that. And I'm grateful for that because I have good ideas sometimes that don't get the proper execution for various reasons. So she's got this off the ground and moving, and other than that, it's just another way of her showing me how she has been by my side this whole time. So as much of a strong warrior as I want to be for these past over 15 years, she really has been in my corner as much as she can be because, there's only so much you can do for a dialysis patient, which we will obviously get into. But as she stated, not to blow by your introduction because I definitely could say a lot more, but I'm sure it'll come up. So I was probably sick really at the age of 2021. I probably, had a lot of, this is probably because this is all just, in
trying to remember.
Guess, or, because nobody knows exactly how I crashed into dialysis.
So that's what it's called when you start to need dialysis, is crashing into.
Yeah, because if you end up in the hospital and, like so many people, that is a big topic of discussion now too, no symptoms until it's too late.
Right.
And saying too late means having only 10% kidney function, which is what I had, and having to immediately start dialysis.
So that's stage 5 kidney disease.
Stage 5 kidney disease, which in the medical world they call it renal disease. Now that's also another topic of trying to change the language so that people understand, because what does renal mean?
Yeah, because if you say to someone, "Oh, my sister has renal failure," they'd be like, "What? Can she not see?"
Right. Yeah. Or like they think adrenal
that's where
glands.
My mind goes, just because retinas and...
Yeah, people think adrenal glands because that sounds like renal. And these were things that I thought too, because I was, I was 22 when I found out everything, but it was just kind of a long time of being sick and not knowing what was wrong with me. And I thought, is this what it's like to be,
Now, I know you may not want to talk about this, but you were not insured, so going to the doctor was something you would have to be prepared to pay for.
I don't mind talking about that. I mean, this is,
16 years
16 years ago, so nobody had health insurance. It wasn't a thing.
Right.
I was just a kid, and I was bartending, so of course I was out drinking and, things like that, which I was doing before 21. But I thought, is this how it is to be 21 and be hungover all the time? So I quit drinking, and I was eating nothing but like cottage cheese and pineapple and all these good things, but not knowing that my body wasn't getting rid of that potassium, these healthy things that your kidneys normally filter out, the things that your body doesn't need, and my kidneys weren't. And so I ended up in the doctor's office finally, after waiting for
Well, I remember that you said that you knew you had to go see a doctor, and you had to set up one with a doctor that was going to do a sliding pay scale.
Right.
And then you ended up waiting 2 months.
Mm-hmm. Yeah.
Now, you probably should have went to urgent care, but I think you probably didn't feel like it was urgent enough to go to urgent care. Plus, you're thinking, urgent care is going to be expensive. How much am I going to have to pay for that? So you waited how long between knowing you needed to go see a doctor and actually seeing the doctor?
That actually probably got close to like at least 8 to 10 months. And so that's
Really?
almost a year. Yeah. Well, because I was in denial, because I always just shook everything off.
Yeah.
Everything. I didn't need a doctor for anything, you know. It wasn't until I was having terrible headaches, nosebleeds, and very badly swollen ankles after, you know, a long shift at the bar and being on my feet. That was back when the customers smoked cigarettes in the bar.
Gross.
And so I thought it was that. Gross. I would get in the car and just immediately change my shirt and everything because I thought I was just allergic to the smoke. Like, I was thinking of all these things.
Well, I have to preface that by saying I say gross just because I don't have a problem with people smoking. I know a lot of people that smoke. That's fine. As far as I remember growing up as a kid and being able to smoke inside, and I would have to go to a separate space because I think I had kind of an allergic reaction to it.
Yeah, and your asthma and everything else. Yeah,
so like that's why I say gross. I don't judge you if you smoke, trust me.
Well, but that's the whole premise of, like, we didn't know or care about these things. Like, parents smoked in the car with the kids, and, you know, that's just
and now that's illegal.
Yeah, that's just what they did. And so these are all things, I'm not saying that contributed to my, you know, kidney failure, but the things that probably contributed to it, they're guessing, because I did crash into dialysis, is untreated UTIs and bladder infections that, you know, were out of control, because I was only seeing a female doctor every year for, you know, that was what I thought the bare minimum.
So you were going to the gynecologist.
Right, and it was just the bare minimum, and that's all I needed to do. Well, they were recording that I had blood and protein in my urine, which
Were they telling you that?
No, but that's very common now that I find out, you know, when people are stage 2 and stage 3, their doctors really aren't that concerned, and they should be. And a lot of people, you know, this is controversial, a lot of people will say, well, they want you to go on dialysis because then they make money from, you know, this and this insurance, and, you know, so that's a whole another ballgame, another conversation.
Where would you be at? Do you know? I mean, if you don't know, that's fine. But stage 1, like you're saying, most people probably don't even find out until they're like stage 3.
Right. Yeah. And so if you're stage 1, then, you know, that's a doctor that's really up on everything and really being
that catches it early.
Yeah, really being proactive and
depending on what problem you have, it can be. I know, because I've heard of people going on dialysis and being able to come off depending on what's causing their renal failure.
Right, and if it's acute kidney failure, like from a car accident, or, like, you know, I've heard of COVID, you know, doing that kind of thing. If it's acute, then it is reversible most of the time. I mean,
as long as they catch it early.
Yes, but if it's chronic, like me,
because your kidneys were just scar tissue.
Right, and you told me that you remembered me calling.
So I do remember.
I don't remember.
Okay, so I was working and I hated. Samantha said she had to go to the hospital to get a biopsy on her kidney, and I was like, "What? That came out of left field." I'm like, okay, because Samantha didn't get sick. Like, you never really got sick, not a whole lot.
Well, I didn't.
I was the one that would, like, get sinus infections and all that other stuff.
Yeah.
But you said, I have to go and I have to get a biopsy on my kidney. And I was like, what? Okay, why? And then you said to me, you called me and I was at work, and I remember you said, Tiffany, this doctor came in and he had his, I don't know if you can see me, but I'm holding a notebook. And he looked down at his chart and said, yeah, your kidneys are nothing but scar tissue. You need a kidney transplant. And it was so matter of fact that I cried when I found out, because I was like, no compassion, no bedside manner. You were there by yourself, and it was a lot to take on because you don't know what's going to happen, but you know that is serious.
Right. I didn't know what any of that meant, and, you know, I had a really great female. Well, she is a female. I'm not saying that she's a gynecologist, but doctor when I first went into the doctor, and she said, you're going to have the biopsy. It was because my blood pressure was through the roof. She was like, this is like levels of a middle-aged man having a stroke. It was like 220 over 100 and something. Wow. And so she's like, if it doesn't go down, I'm going to have to send you to the ER. But she gave me medicine. It went down. And then, you know, had a kidney biopsy, you know, a few days later or whatever. And then that doctor had told me. And then from there, it was like, you need dialysis. And I feel like, to this day, I'm still processing all this because I was a kid.
Well, you don't have time even, really. It's just go, 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 go.
I went where they told me to go. I did what they told me to do. And I was fearless because of, number one, being a kid and being resilient, and because I didn't know any of this. And now, all these procedures and all these things later, I mean, you know, dialysis patients, we have countless surgeries, countless procedures that people don't understand that. You know, people don't realize, you know, I might look well put together, but, you know, there's a lot.
Well, no, I'm just kidding.
There's a lot under there that, you know, oh, you don't look sick, or you're too young, and this and that. And I mean, back in, you know, at 22, I got that constantly from doctors and nurses and everything.
Right, because they're probably not used to dealing with a patient who's so young anyway.
Right, and I still get it even at, you know, almost 38 years old. Like, you know, you're just so young, and, you know, being able-bodied, but being in these support groups and meeting all these people through the advocacy I've been doing with Next Stage and everything else, I am the face of a dialysis patient, because we are all, normal. We all are, trying to just have regular lives. And
speaking about the advocacy, one thing that you told me that really stuck with me is you said that you're working with a couple other people and they're not dialysis patients, but they're advocates. Mm-hmm. And you're a patient advocate, which means that you're on dialysis. And one thing that was interesting is you said that a lot of times they'll get the conversation going with the patient.
Yeah.
And then they're drawn to you because you're experiencing this. You're doing this 4 times a week at home.
Yep.
And this is your life and this is their life. And I think it's being able to connect on that level. Like, I would want to speak to someone that was going through it.
Yeah, because there's a shift in their body language and their attention and their mood and their reactions whenever they're talking to, I'm usually with a KCA, which is a kidney care advocate, and that person is going to be someone who works for Fresenius, and they have various.
And Fresenius is the company that.
It's the dialysis company, and so they actually own Next Stage. Next Stage is the
home dialysis, home hemodialysis.
Yes, that's who makes my machine and everything.
Because there's other ways to do dialysis at home. I know there's PD, but I can't say that.
Yeah, we'll get into that too. But so when the patient who's at the dialysis clinic is talking to the KCA about options for home dialysis, they are just no, I don't want to do it. That was me
that's
too.
What you were.
Yeah.
Because I have to preface this by saying, can I say it?
Yeah.
I think I don't want to embarrass you, but
no, I'm not
Samantha was so afraid of blood.
Yeah.
Let's just say when Dad would take her to the doctor and she had to get blood drawn for routine checkups or whatever, she would pass out in the chair. Mm-hmm. And then also the other thing is during maturity, we'd find you passed out in the bathroom.
That did happen.
We were worried you were going to hit your head on the sink.
That did happen. Well, there was something about seeing the blood or my own blood, thinking that, I don't know, maybe I just. But
my point is why I'm even bringing it up is the fact that you went from that to actually, you're doing your own.
Right.
Into your
needles,
catheter, your own needles into your catheter.
Fistula.
So, I'm sorry, catheter. Oh, catheter, because you have the catheter right now.
But, okay, so the patient, when they're talking to the KCA, they'll be completely shut off, completely against it. And then as soon as they find out that I'm not a social worker, that I'm a patient, just instantly arms uncrossed. Way more receptive. Yeah, arms uncrossed, like, really, you're a patient, And so that's why sometimes I will make sure that my catheter dressing is showing. I'll roll up my sleeve, show my fistula, because they don't believe that, and I've had KCAs say, you could look that great too if you do home dialysis, but
that's sweet.
That's a
you
little,
do look really great.
That is a little subjective, but so anyways, yeah. So then I was going to do PD, which is peritoneal dialysis, because I was 22, and they said, this will be perfect for you, so you can still work and go to school and have your days free, and you do it at night at home. Had everything set up, and I was living with Heather, our oldest sister.
There are 5 of us, by the way.
Because as soon as everything happened, she knew, because she was old enough to know, and I wasn't. And she said, you're going to come stay with me, because she knew that I wouldn't be able to work as much, and she knew I was.
You still tried though. You would go from dialysis to work.
I was very resilient back then, and I did work as much as I could, which was basically full time. And I still wanted to keep my life and school and everything, which is why I was going to try PD. Well, without getting too much into it, because the dialysis patients listening will know what I mean. I had the abdomen catheter placed for PD, which is peritoneal dialysis. We were just kind of like, okay, you'll go to the training and learn how to use it and flush it and this and that. It was kind of like this process.
Because you do that while you sleep.
Yes.
Okay.
There's a way to do manual exchanges during the day that people do without using the cycler machine, and they can do that, while they're working or whatever, and it's a bunch of different exchanges throughout the day. But I'm not an expert on PD because I've never actually done it. Like, I had the catheter placed, and I went to train to use it, and I still have a little PTSD from that, because it was the worst pain I had ever felt. And then they had to take in and look at it and manipulate it, and I was awake while they were put a wire in there and were moving it around, and that was also another terrible pain where I felt like the girl on The Craft when she's on the table and they're doing it's so fake back then on that movie, but they're peeling her scar tissue off, her burns off, and yes. She's screaming.
Okay, I remember that now.
She's screaming. Well, that was the first experience.
That was your visual. That's where you went.
That was the first experience I had that I was awake. I mean, I had the catheter surgery before that and the biopsy and all that, but that I was awake and having such a traumatic thing happen, which there were many after that, as we know. But So they're moving it and all that, and then they find out that it's matted in my intestines, and then they have to remove it, and my appendix had coincidentally burst, which I think
Oh my
they were messing
gosh.
around in there. So
I don't remember all of this because everything was happening and I was just getting as much info as I could.
Yeah.
And it was all happening so fast that it was hard to follow as your sister, as an outside
well, and I
patient.
don't tell anybody anything.
Which
know,
is one of the reasons we're even doing this
Right.
is because you don't talk about it. Like,
Yeah.
you don't go up to every person and say that you have it. Like, unless it comes up in conversation, most people don't even know.
No, because like my high school friends who still see whatever I post on Facebook or whatever, none of them know.
Right.
Like I've had people like, oh, I didn't know that your health was still, and I'm like, well, because they're not understanding that like you do dialysis until you have a kidney transplant, or some people don't have that option.
I think people have an oversimplified view of getting on a list and
Oh yeah.
How quick that process works.
Yeah.
And how long that actually takes, and during that time, your body still has to filter it out. It has to do the job of the kidney, so you have to do that artificially. But I did not know that I knew that your appendix burst, but I did not know that it was matted into your intestines, and you could have went septic. That's so dangerous.
So they took that all out, and then I wake up with these tubes popping out of my neck.
And they had placed the catheter there for dialysis.
And my ex at the time, he had said, that he watched them do it, and it was all crazy. It was like this big.
He watched.
Huge
How did he
needle.
watch?
Because they do it in the room.
And he was in the room?
They do it in the hospital, like in my room that I'm staying in, because that's like just a outpatient kind of thing. So yeah, so I wake up with these tubes hanging out of my neck, and it's an emergency catheter, which
So they did it while you were under, or
I was kind of like, I think coming.
They were sedated.
Yeah, I think I was slightly sedated at that point. I can't really remember. I mean, it was so long ago. But I did wake up with the lumens, as we call them, coming out of my neck. And, the original way that you would do it is you're under, and it's the one I have now is like under the skin, and the tip of it is in the right ventricle of your heart. So, and the reason I have the catheter now is because I'm supposed to have my fistula worked on, which, this is all stuff that if patients are listening, they're totally...
So now what's wrong with your fistula?
So it has a narrowing, which is very common, but I also wanted to get it, as we call, cleaned out, because it's starting to lump up a little bit. Now, I feel very vain saying this, because if you were to Google pictures of dialysis fistulas, it's insane. Like, prepare yourself. And I've seen people over the years who have just huge golf ball sized lumps on their arm because they're pseudoaneurysms. And I do use the ladder method, which is like you rotate the sites. So like I'll go in one and I can see where I went, and so the next time I'll go a little bit below it, and then up until I don't have any more space left, and then I'll
I don't
start
think it's
over.
vain to say that there is something that can help you reduce that and wanting to get it done because you don't want lumps on your arms. I don't feel like that's vain.
Yeah, and because it wasn't lumpy until like in the last like year or so. It's like I saw one and then it started coming up, and I'm thinking, am I doing something wrong when I'm self-cannulating, which is self-cannulating is putting the needles in. And
Wait,
so
say that again?
Self-cannulating, like cannulating.
Okay, now spell it.
C-A-N-N-U-L.
Oh, you can.
Oh, cannulation
I didn't think you were to be able to spell it.
Cannulation is the insertion of the needles.
Okay, cannulation.
Yeah, so I self-cannulate.
No, you don't.
Which is putting the arterial needle in and then the venous needle. There's two big needles that go into my arm, or a dialysis patient's arm, when they do dialysis, unless they're using the catheter. Which
so one's
like
for the vein and one's for an artery?
No, because the vein and artery are connected.
No, that's wrong.
No, it's okay. The vein and the artery are connected, which is what the fistula is. They're surgically connected, which there's a way to do it magnetically now, which I didn't know. It's a subcutaneous or percutaneous, procedure.
But is that newer?
Yeah, and it's called the ellipsis fistula. It's like really interesting. I mean, I wish I had that option, but that's okay. My arm's all sliced up and like there's a lot of scars there, but price to pay to live. So I am going to have him, go in and look at it and everything, which he said while he's in there, he might have to do a graft, which is a little plastic piece that like, I guess is like emulates a vein, but I really don't want that because I'm so prone to infection with anything.
Right.
But
have you had one before?
No, I'm hoping he doesn't have to do it. I've been like always trying to avoid it, hoping he doesn't have to do it, and he always
because I feel like I've heard you say something about it before, but
I did, because he told me last time that if he has to work on it again, he's going to have to do that, and now we're working on it again. But he's a great surgeon, and I love him, and that's Dr. Knowles. But I trust him, so I'm going to trust him to do it. But he was supposed to do it already, which is why I got the catheter. But then it was found that I have blood clots in my right lung again, so I have to do the Eliquis, which makes me feel like I'm 80 years old because I see those commercials all the time. But I have to do the Eliquis until about April, and
the
then
Eliquis is blood thinner?
Sorry, yeah, blood thinner. So I'm on that right now to, make sure those clear up again. And the first time I had the blood clots in my lung was after I had my transplanted kidney removed in March of 2020.
Right, because I remember you had issues with the blood thinner.
Right, I got, the issues with the heparin, the blood thinner that every dialysis patient knows about, is that was back in the beginning of my home dialysis. I was just having terrible bruises everywhere, all over my legs especially. And
that's right.
I was seeing a hematologist and we just couldn't find anything and, all this. So I just stopped the heparin and that has helped a lot. I just
that's what they told you to do. They told you to stop it.
Yeah. I didn't stop it on my own. Yeah.
You're like, I'm not taking this medication.
No, so that the heparin is something that dialysis patients usually get in the beginning, middle, and end of their treatment.
Okay.
And there's all sorts of different, right now I have hep blocks in my catheter where I have to put it in there to kind of keep it open at the end of treatment. So there's a little bit, but it's not going inside because it's only the amount of what the lumen is. So there's 2 tubes that hang out of this catheter. It's a venous and an arterial, just like I was going to say with the fistula.
Okay.
You have
so that is one vein and one artery, essentially.
Pretty much, yeah. So the venous, or you do the arterial first, which is for blood flow out, and then the venous needle is above that, is the second needle that you would put in for blood flow back into you. So while it goes through the cycler and then it comes back to you. And I mean, I guess it's like a pint of your blood that's outside your body at all times.
All times, a pint of blood
during dialysis, yeah.
Because I know that's got to be tiring.
Right, and I've had, I have a good friend who she was like, don't you feel better after? And I was like, kind of, because then I don't have the fluid on. And
I feel like the first time you did dialysis, when you were 22, you were able to just go straight to work and you felt great. I think this time, and it could be because you're older, and it could be because,
It is, but I will say that it didn't really feel great all the time, but I was
But you were just going to do it.
Very good at hiding it at that age. I bounced back
I don't
very
know
quickly.
how you did that.
I mean, I had to go to concerts and hang out with my friends.
Now, the first time Samantha did dialysis, you did it in center.
Well,
you
it was
did
in
not do it at
hospital
home.
was the first time.
No, I mean the first, before you got your kidney.
Yeah. Sorry, yeah.
In general, the very first time is in the hospital, and then after that was in center?
Yes, I did 4 years in center before I had a transplant in 2011, and that transplant failed in 2018. And that's another misconception that people have. They automatically think my body rejected it. Well, my body was kind of always in a chronic rejection state as far as the antibodies that were built up, and so there are many different measures that Dr. Fuller had me take at UNC, to keep those antibodies at bay, minimize them. There was rituximab, which is a very strong dose of, I guess basically chemotherapy. And I had a half dose and then another half dose months later. But that stuff is so strong that and then I had plasmapheresis and all these things.
I remember that.
It was a rough 2 years, I would say, after the transplant in 2011.
But then after the first 2 years, it was pretty good for about 5, right?
Yes. I was pretty stable. And so, there was just a lot of scar tissue that happened from all the different treatments, from all the anti-rejection meds. So it was a very catch-22 kind of situation. And, Dr. Fuller and the team at UNC, they did say, you did everything you were supposed to do. So, you're still definitely a candidate to get back on the transplant list and, all that. So that, that was fine. And, they're very, I love my transplant team over there. They're very supportive, and I did do what I was supposed to do. I took my medicines, and of course, there's times when I probably slacked off, down the road and felt a little uncomfortable.
For those of you that don't know, UNC Chapel Hill, we're here in North Carolina.
Sorry.
Coming from you from Johnston County, North Carolina.
Right, and so it just. I had the PD catheter, had to go on hemo emergency, and this is, I remember it was Mother's Day, which, that just stands out in my mind, that I was in the hospital, and this is in 2007, right? Yeah. And they, were like, you got to start dialysis now. This is just, we can't wait any longer. And so then I end up in center. And then the last year, almost year of my dialysis life at that time, I did nocturnal at the center, and
I remember that.
And that was supposed to be really good. That was supposed to be, you'll sleep while you're doing it.
So to be fair, you do have the most sensitive hearing I know of anybody, and I remember your complaints would be like, someone was breathing weird, and someone was crinkling a piece of paper.
Well, you're in the dialysis clinic, in a hospital bed.
Right.
But there's all these people around you still.
Right.
I can't sleep like that. I could be as tired as
I don't know that I could either.
And they tried to give me trazodone and this and that just made me feel like a zombie and still didn't sleep. So I'm up, on my phone playing Words with Friends all night, for 8 hours, which I'm getting slower dialysis. I'm getting a better cleaning, not understanding
So
this.
is it better to do it 4 days for less time than it is to do it for 3 days, 8 hours?
Yes, and so the home hemo, like as a solo patient, idea is more frequent, shorter treatments.
Right.
But now it's also, there's the nocturnal option, and you have to have a care partner for that,
right.
Through with Next Stage. And that's kind of like what I was doing before at center, or in center, with the nocturnal, the slower dialysis also. So it's kind of like an either or thing.
Now,
either
how
more
would
frequent.
you, if you did it the slower dialysis overnight and you had, a constant care partner with you, how many nights would you have to do that?
I think that is like 5 to 6 nights, I'm pretty sure.
But it's better for your body?
Yes, and some people do it every night. Like some people want, I feel like that commercial, we do it every night. But so some people do it every night, and I think there's people who I've seen actually ask their doctor, can I do another day? Can I do an extra day? Because, especially the older retired people and they're home anyway, they feel better if they do like, 2 to 3 hours.
So they're waking
every
up
night.
feeling great.
Right. And I do have, my boyfriend, he would be my care partner. I just, I can't ask somebody to do that. Like, that's just me. I can't.
No, I mean, I get it. It's always been very difficult for you to ask for help, even for like rides to the hospital. You're like, I'm about to go have this surgery. I'm just going to drive I'm like, you're going to drive yourself?
Yeah.
You're going to drive yourself home from dialysis? No, I'm going straight to work. It's like.
Yeah. I've done that, and I've put my work clothes back on and went and but no more. And so that's why I'm so grateful for home dialysis, because now, when I went back on dialysis, I guess I was, 30, 34, 35. And I was like,
did you just blink because you realized how old you were?
Yeah.
Like I saw it in your face.
And I was like, I don't know how I would get home from the clinic at this point. And, I basically crawled on my bed sometimes. And that's just me. A lot of people.
So most people that are doing in-center, do they have transportation other than themselves driving them to and from?
A lot of people, but that parking lot's full when I go there.
Right.
And so, there's people just like me. And some people don't want to do home dialysis. It's not the best for everybody. Some people don't have. They're scared to do it solo, because North Carolina did pass a law the same year that I started, so I'm lucky. I feel very blessed for this, that I could be a solo patient, that I don't have to have a care partner. I can be...
Well, I think that's what's best for you anyway, because it doesn't matter how many people you have in your life. You just are not a person to ask for help.
Right, and I don't tell people what's going on. Like, we have a couple nieces who are very... caring, and they do come over and they do want to help me and they do support me.
They're super inquisitive.
But they... don't know most of the time. They'll be like, what, you didn't tell me you were having surgery? And I'll just be like, sorry, I'm out of it from the meds or whatever, if we're talking. And because I just can't do that. And like, my neighbor who's there, who happens to be my best friend from high school's mom, she's always like, please tell me when you're going, please tell me.
I think it's good though. I know that you don't want help, but I still think it's good to, I know you text me, you'll say, hey, I'm going in, or I'll be like, hey, just text me and let me know that you
I do that now.
Made it home. Yeah.
I do it now. When I was, back then, it was like, it wasn't
I never knew.
Yeah, it wasn't that I wanted to hide anything, but I just didn't want
you were so independent.
That attention and people feeling bad for me, because people, when they find out, because my work, they've just been awesome over all these years, and it's a family-owned place, and I've just been very close with the family in numerous ways throughout the years, and they've always had my back, and especially I'll just say Jamie, she's always organizing.
You know who you are, Jamie.
She's always organizing a fundraiser or doing this and that and donations, and it was very easy for me to say, I can't work this week, or I can't, and I still do that. I just, help
because
help
I
out
don't know a lot of jobs, even if you're on dialysis, that would even tolerate that.
No, and I see that a lot, people losing their jobs, and and
it's through no fault of their own, and it's also not any fault of the business, because they need reliable people, and you can't be reliable when you're on dialysis.
Right, and so I was always grateful to have that as a backup for anything, no matter where I went in my life, or what I did, or what I tried to do and didn't succeed. I always could go back there, and that was very comforting, and they were just always there for me. And so after customers finding out through that way or whatever, how are you?
Yeah,
how are
and you hate that,
doing?
don't you? Because I know you're not a fan of that.
How are you feeling? And so, like, I'll do it back. I'll be
it's like, do you have an hour for me to tell you exactly how I'm feeling?
Right. And so, like, you know, and it's it comes from a good place. I'm not, you know, but I'm popping their beer open and going, fine, how are you? You know, I'm like, you know, kind of not, you know, and I was such a sarcastic little jerk back then. So
back then?
Yeah.
I'm just kidding.
So you know, I'm a lot nicer now. And so
you are.
I think that a lot of me being that way back then and being so defensive and being so, you know, just ridiculous about it was because I was so mad about it myself. Like I
think that's how you handled it.
Yeah. And now I have control over my dialysis from doing it at home. I have control over, I have that autonomy and that empowerment to be able to know, you know, what it's actually doing. I think if I knew back then, if I wasn't one of these who just went in and, you know, looked the other way because I don't want to see the needles and didn't care what they were doing, didn't know what those numbers meant on the machine, none of it, you know, I just let them control it. I'm not that person. I didn't realize all this stuff now.
Right.
Doing home dialysis makes me realize
but
how much.
But you fly fine.
What do you mean?
You fly fine. Like,
Yeah. Sorry.
No, because I'm thinking about like driving. Like I'm that way about driving and flying. Like I want to be driving. And I don't mean to cut you off, but I was thinking about like being in control. Like I have issues with being a passenger.
Well, I'm kind of that way a little bit now, but this is also goes along with the fact that the more procedures and surgeries I have, the more scared I get. Mm-hmm. Like, you know, I'm literally shaking when I'm going in to have some routine dialysis procedure. And
I know you're really worried about the one coming up on Monday. Do you want to talk about that a little bit?
Yeah.
So I'm taking Samantha at the butt crack of dawn.
Oh my God, like 4
to UNC. I'm not exactly sure what the procedure's called. I'll let you talk about that, but I know you're the first case, so.
Yeah, I'll be the first case that morning, and so it's, we got to be there at like 5. So it's a partial thyroid / parathyroidectomy. So I had 2 nodules, lower and upper left on my left thyroid glands, and so they biopsied both of them. The first one was benign, the bottom, and then that top one they did it twice, and they could not get enough tissue to test it. Mm-hmm. So they're just going to remove that. Well, I've had problems for about a little over a year with my parathyroid, which is very common in dialysis.
Now, I have a question about your parathyroid glands because I know you cannot live with them, and I know they're going to implant one into your arm. But
you can't live without them?
Oh, I'm sorry.
No, I just want to make sure that's what you meant.
You can't live with them. You can't live without them.
Pretty much.
They're just a bummer. Okay, so they're going to implant one into your arm.
I know, it's so weird.
It is weird. But how do they know that some of them are functioning enough to do that?
That I don't know, but I do know that if they're enlarged, then they're supposedly no good. So they're not going to know until they get in there. Now,
what happens if all 4 of them? Well, one of them has to be working, or you wouldn't.
Yeah.
Be okay.
See, that's the stuff that I'm not real too sure about, and you know, I knew that I'd have questions after he asked, "Do you have any questions?" But you know, so these are things that I'll find out. But so the parathyroid. Now, I was explained by my dialysis doctor, Dr. Oliverio. He said that your thyroid is like a bow tie, on each corner of that bow tie of your thyroid, there's a parathyroid
That's
gland.
a great visual because it makes me think exactly of how it probably is.
And they're really, really small, so sometimes they can't even find them.
Oh my gosh, like how small?
I think I read something like a pencil, I want to say eraser or tip, but those are two totally different. so they're small.
Well, the tip is super small, and it must be the size of the eraser.
Maybe. So
like that's still pretty small.
So see, these are things that I just like.
Well, there's always so much going on because this is. Let's see, you're gonna have 4 surgeries in like the past month and next month.
Yeah, I've already had 2 this year with the the one catheter,
same one,
and
basically.
then that catheter was falling out, the cuff was exposed, and so a new catheter. Supposed to have my fistula revised eventually after, now it's going to be after the thyroid surgery and all that. But basically, so the parathyroid thing, I'm gonna have to explain that just a little bit. When your phosphorus is high, which is a common problem with dialysis because everything has phosphorus in it, I think, except for fresh fruits and vegetables.
And it's not labeled on labels.
It doesn't have to be unless it's a certain amount, like the.
Oh, it has. If it's like above a certain amount, it has to be labeled.
FDA, yeah, I think that's how it is. So, but we all know that dark sodas, like all dialysis patients, dark soda, junk food, chocolate. Which I'm not too big into chocolate. I can say no to that.
Really?
Yeah.
You're a strong
yeah,
person.
I've just been that way. I can't say no to sour fruit candy and all that. So, but
I would prefer chocolate over like
No, give me a
Sugary
Tootsie Pop
candy.
any day. Which I guess the Tootsie Pop has chocolate in it, but Starburst, that's my thing. So
you love the Starburst, huh?
yeah, and I had done really well because I used to sit and just eat like a whole bag of Sour Patch Kids or whatever while I'm doing dialysis. That was my thing. I have to do dialysis. I'm allowed to eat candy. Well, 3.5 years of that, 4 times a week.
Right. But you didn't
really
realize that was in there, or that there was that much of it in there, or did you?
Well,
know?
the phosphorus thing I don't think is too bad from the candy I was eating, but I do realize the things that I was doing. Now, looking back, the reason why I didn't care from, I would say, May of 2020 until I finally started to clean up my act in 2021 when it was, already kind of out of hand. When I had my transplanted kidney removed and it aligned right at the end of March when COVID started and all that, and I stopped working at the bar for a while. And I was depressed, and I didn't realize it because I was at home all the time. My dialysis was at home. I wasn't seeing people. I wasn't socializing.
And that's weird for you because I think there's 2 ways you get energy. It's like I need the alone time. You do better when you're around people.
Yep.
Like you do like alone time, but you cannot just be alone all the time. Like I could be alone for days, and if you come check on me in 3 days, I'll be like, I'm great.
Yeah, no. I've gotten better about being more of a homebody just because I'm older and I like to be at home. But I do need that social interaction to recharge. And so it wasn't until November of 2020, and I guess I do kind of attribute this to my therapist that I had at the time. She told me about, the company that I went and substitute taught for and everything. So I feel like she was put in my life for that reason because the therapy didn't, go as well as I had planned. But so, I started substitute teaching November of 2020 and then, was socializing and all that. So looking back, I know I was pretty depressed not taking my binders, which the binders are to bind with phosphorus when you're eating to get rid of the phosphorus. Okay. Now,
because that's how it evacuates as it gets.
Yes.
And that's something that happens in the kidneys usually?
Yes, your kidneys normally filter out the
phosphorus.
The phosphorus.
So then you have to take a binder to identify the phosphorus.
Yes.
Okay.
And the binder, could be Tums, which is just calcium, which is what I was doing because that's kind of the lazy way.
That is why you always have Tums, isn't it?
Well, I have heartburn too, but it's just a good, double thing.
So do you still like a lot of spicy food?
Yes.
I don't know. Oh, I can't do it.
Yeah, I love
Emma
spicy
and Sean
food.
love spicy food.
Yeah. So I wasn't taking the binders properly, and the regular binders that I do have now, they have iron in them, and they're these big horse pills. And so, once I stopped taking the anti-rejection medicines, I didn't want to take any more pills. I was like, this is great. I'm on dialysis. I'm not taking any pills. Well, there's still supplements, and there's still other things, even if you're not on any, medicine. And,
right. So in this exchange for doing dialysis, you do have to take a bunch of pills.
Not always, because there was at the beginning where I didn't, except for the binders.
Okay.
Now I've got some other things going on, but so not always. I mean, some people don't take anything. Some
really?
Some people are fine. And I have low potassium, but a lot of people have high potassium and might have to take things or whatever. They're kind of always telling me, watch your potassium, eat oranges. And, then when you post the things on Facebook on the support groups, they're like, there's too much potassium in that. If I post my
Well, I think the important
thing
to realize about food in particular is that no one is on the same diet. No renal patient seems to be on. I mean, I'm sure there are some that are on the same kind of diet, but as far as a general renal diet, there doesn't seem to be such a thing. You need to listen to your doctor, and you need to take a recipe and modify it based on what you need individually based on your labs. Right,
and a lot of even medical people won't know that because if I go to the hospital, for anything, it's always put her on the renal diet, and so they're going to bring me low potassium.
So they have an official renal diet, but what is it short?
It's going to be low potassium, low phosphorus. It's going to be low sodium, and then a lot of people on dialysis are diabetic. So,
right.
So
then
you have that.
Carbs.
Yeah, and I'm not diabetic. And so we're all different. And that's what the thing is with dialysis. I mean, nephrologists and transplant doctors and everyone, all the medical professionals involved in dialysis, they have a tough job because we are all so different. It's ever changing. And, we're just all, my dialysis now is different from my dialysis before because I still had a little bit of kidney function as far as I still peed. I still urinated. I still made urine, however you want to say it the professional way. Because I had, my native kidneys were still making urine, but not eliminating toxins.
Okay.
And so I still, peed every day, at least once a day. And it was just a little bit, but it was every morning, which I used to just make jokes because I was, I was the ugly friend with the purses at the bar because
you never had to use the restroom.
No. And all the girls, hey,
you're like, I got this.
And I'm like, and I used to always hate when I was, before my dialysis, hated let's go to the bathroom. I just hated that whole thing about everybody being in the bathroom together. Like, it wasn't my thing.
Like, we're already at the bar together.
Right. It wasn't my thing. And, you know, so, and plus you get in there and everybody's like, you know, becomes instant best friends. And I just thought it was so fake. It's funny, but it's just,
oh man,
you know, like, oh girl, your shoes. And like, you know,
it becomes like a let's lift everybody up.
Which is great.
I love
great.
that.
And some people need that, you know, and that's great. I'm not knocking that, but I just never was one to want to do that. I wanted to go in the bathroom and use the toilet and wash my hands and leave.
Get out.
So I would just sit with the purses, never had to use the bathroom. I mean, it was like so funny. But now, you know, losing that kidney function of the transplanted kidney, I instantly, when I started dialysis, was not making any urine.
When's the last time you've urinated? Let's talk about this. Let's tell the world.
You're in for a treat. Remember?
You're in for a treat.
3.5 years, which is
really
crazy. Yeah, crazy.
So, because I know I asked you last time we had talked about it, because you said you had. I forget because it's such a normal everyday thing.
Weird, yeah. And it's not saying that you do this, but it's crazy to say don't take peeing for granted. You know what I mean? Like, how weird. Like,
you
like, okay.
Think about
yeah. And I don't tell anybody that. I don't tell people I don't pee.
But so, like, are you at increased risk for UTIs and whatnot?
I would think so, but
no.
but I haven't had any, because, you know, UTIs always.
But see, that's the thing that's kind of misleading about UTIs is I know that they can be seriously dangerous if you're like already sick. I know older people, when they get them, it's like a serious thing, but as a female, you tend to get them anyway when you're younger. So I don't think that you should have been alarmed or anything, because I mean, I've had my share.
But I didn't even know that that's what was happening, probably.
Right.
Because, you know, when I still am this way, I get a pain and I just ignore it until I can't ignore it anymore. I don't know why. I mean, you know, well, we were always taught, and not just us, but that our generation, you know, shove it down. And, you know, everyone's saying that stuff now, like, oh, we used to pull ourselves up by our bootstraps and stuff, but that was wrong.
No,
you know, like, no,
that is not the way to succeed at life. We should be at the doctor.
We should be taking care of our mental health the same way we take care of our physical health, and we should be.
I think mental health is finally getting the treatment it deserves, because I feel like mental health is so important. And I hate to even use the word mental illness, because mental illness can apply to anything. I like it. Like, how do we get you mentally healthy?
Right. And, you know, that's a big thing with dialysis patients. I read every day on these support groups on Facebook, I'm just going to give up. I don't want to do this anymore. And you know,
could see how if I put myself in that situation, like that's why I look up to you, because I'm like, I don't know how she does it. Like, seriously, I would be like,
it's one of those corny memes where it's like, you know, they asked how I do it, and I said I didn't have a choice. You know,
well, that's true though. You don't have a choice.
Like, you just have to.
Yeah.
I mean, and you would, if it was you would
Absolutely.
do it. And you know, but there were times, especially when I was trying to do buttonhole, and everybody, you know, who's been through it knows what I mean by buttonhole.
Is a way to
cannulate,
getting the needle in the skin, that you use the same space, and it kind of creates, like, you're able to go in with a blunt needle.
Yeah, you use a sharp needle about 10 times.
And I'm doing it here, but that's not where it happens.
Some people do have a fistula here. It's wherever you have the best veins. Now, I was lucky enough to have surgeons who care so much about me that my old fistula is here, and it's been clotted off, and, you know, that was a nightmare as well.
Because I remember them trying to keep it open, but I was like, gosh.
Remember, I ended up in the hospital and had to give myself the heparin shots, which was a huge deal, and it was like the baby needle. I couldn't do it, and
now look at you.
I know. So, you know, that fistula is gone, not working. I mean, all the scars are still there. But it's still inside of there. Yeah, all the scars are still there and everything. It's just, it's clotted itself off finally after all the pain and suffering I went through with it, when I, you know, wasn't using it. But then they put another one in the same upper arm, but, you know, in there. And they do that so that I won't have, you know.
Right.
And that was very nice of Dr. Toledo to do that and, you know, make it as best as he could for me. So, you know, these are things that everybody's individual. And so, like I said, you know, that's crazy to have to, you know, you can't do the same thing on every dialysis patient when it comes to this stuff. But so the buttonhole, you use a sharp needle about 10 times, so you're creating a track, and then you go in with a blunt needle. So the purpose of it is for self-cannulation. It's supposed to be the best way to self-cannulate, because you know, you don't have to hurt yourself every time.
Right, you're going in with the blunt needle,
right,
as opposed
and so
to
that's
a super sharp one.
Yeah, that's the thing that they pitch to people who are like, no, I'm not going to do the needles. Like, there's no way, which was me, you know. And so I started with buttonhole, but I feel like there was too many of us creating that track, and so we created a couple different tracks. Because
when you're in center, you're not self-cannulating, and you get a different nurse every time.
That is how it is, but for me, I was in home training, so they were training me to do it. I wasn't in center. I was in the home training department, my own private room and everything. It was really nice. New Hope Dialysis. They were awesome. But it was like there was a tech there and she was creating the track. She wasn't there one day, so then the nurse did it.
Yeah.
And then I had to do it for whatever reason. And it just, I would sit there for hours with this blunt needle and sitting in my room, could not find it, could not get it. And I'm going.
That must be so frustrating.
And I would sit there and cry for hours, and I would have to.
Because I think I remember that. I think you were like, I can't do this. They want me to do this and I can't do it.
Yeah, and I thought, I just need to go in center. You know how many times I told you and told my boyfriend, like, I'm just going to go in center. I'm just going to do it. Because, initially when I got that call when I was in the hospital, with my transplanted kidney failing, I got a call from Susan, the clinic manager at New Hope, and she said, I got a referral from your doctor that you need dialysis. And, before that, leading up to that, I was in denial. I was, graduating from Guilford College, and, it was about July, but I remember graduation day, my ankles were swollen, and I was like, oh, it's because I drove all the way here, and drove for 3 hours. And, Dr. Fuller had told me you're heading toward dialysis, so keep that in mind. No, I'm not going to, it's going to go, it's going to go on the back burner. I'm in denial, no way. I knew my urine output was decreasing. I knew I was getting my little bags that I get under my eyes. I knew I was bloated. I knew it. It was all the same symptoms. All the signs,
but you were just like ignoring it.
Again.
Knowing, it's like when you're a female and it's about that time. And you're like, no, it's not. I refuse this.
Right. And
I repeat this in the name of the Lord.
Yeah. So my body likes to do this thing where it'll give me, like if I have a big milestone or things that I need to work on, it'll give me that time. But then after that, when I have time to be sick, so it was October of 2018. And
when did you graduate from Guilford? I can't remember.
2018. It was like May or June or whatever,
so you had just graduated.
Yeah, and I knew I was sick, and that's the first time that Slim went back to Gambia to see his mom, my boyfriend, Slim.
Slim is from Gambia, the Gambia in West Africa.
And he's awesome, and I'm sure we'll talk about him more. But
he's real short. He's so short. He can't see above the table.
He's 6'5".
and I remember when my boyfriend Sean took your boyfriend Slim to play basketball, and he was playing with people that were, I guess that he worked with. I can't remember who they.
Sean.
But I just remember so Sean's 5'10", and he walks in with Slim, and they're like, "This is not fair, man. This is so not fair."
He's a basketball player. But yeah, so he. He was out of the country, and I took a picture, and I saw this picture recently when scrolling through the Google photos, but my ankles were swollen. And so, I knew, because I was going to work.
So looking back, you're like, yeah, Samantha.
Right. So I'm in the hospital. Susan calls me from the New Hope Clinic, and she's like, I have a spot for home training available. And I said, what? Because I didn't know. I didn't keep abreast of the dialysis stuff this whole time because I have a kidney transplant. You can't tell me anything, And
this is my time off.
And I would drive past the clinic to go to work, and I would always kind of,
glad I don't have to go there.
Well, it was in a humble way, though. I was like, I know one day I could end up back there.
Right.
But you know what I did for some reason? Remember, the Catholic came out in me, and the Grandma R.C. came out in me because I would always do this when I would go past, because it was like that's what you were supposed to do when you're going past an ambulance or
I remember that when we went to Catholic school when we were younger.
Yeah, so I did that because
every time we hear an ambulance, the whole class.
Yeah, and I did that because it was kind of a like a nod to I used to go there. Don't forget where you came from, and that's how I like to live. A lot of things with don't forget that, and so. It always was with me, and I knew that it would eventually happen because, again, misconception, transplanted kidneys do not always last forever. Sometimes they do.
I mean, I know that we talked about it before you even got it, that they only generally last about 10 years.
Yeah, especially with a cadaver donor. So 7.5 years, I'll take that. I'll take it.
Of course, anyone would. Who
right.
wouldn't?
Yeah, and she said, I don't have a spot in center available, but this is the center I wanted to go to because it was the center I last went to before I had my transplant. There. Kind of. That was the nocturnal place. But, I could have tried to find something closer to me, but I think I wanted the same doctors and things like that. Well, I think
it was fake because it ended up working out great.
Right. I'm grateful for it because, she was like, and so
sometimes when you're forced into a decision, sometimes it's the best.
It is. And it was in this case because I said, fine, I'll do it, because it was like, no, I'm not going to do the needles. I'm not going to bother my boyfriend with it. I don't have the space. We're in an apartment. I'm not going to do any of this. No way.
Which none of this is true because you do have the space in the apartment.
Right, and these are the answers I hear when I'm doing the advocacy for Next Stage.
Right.
Immediately, no, I'm not putting, I'm not sticking myself.
You were that person.
Yeah, and we call it sticking. I'm not sticking myself. I'm not putting the needles. And she said, well, I don't have a spot in center. And so I was like, okay, fine. And in the back of my head, I'm like, I'm doing this to appease her, but I'm going to go in center. Like, there's no way that I'm going to do this. And then 3.5 years later, here I am. And it's the best decision. Well, I was forced into it. But, if I have to be on dialysis, then this is it for me. This is, and it's not for everybody.
No,
I'm
sure.
There's reasons why people can't do it or just shouldn't do it or...
Now, with home dialysis, is there a rule about animals in the house and stuff like that?
I think there is. I think that it's like when you're hooking, because I don't have any animals.
Because I know, like, when you're hooking into the machine, everybody has to wear masks and gloves and things like that. That's in the room.
So I'm pretty sure that the animals have to be out, but once you're hooked up and everything's
normal
closed, that they could come in. And people, you know, there's some people who are like, I don't care. My you know, like Peanut, he wouldn't. If you were doing dialysis, he would not leave you alone. Like, he would sit with you while you're doing it. I think some clinics and some doctors would maybe prefer that they didn't sit with you, but some people are like, this is my support animal, or this, you know, I can't, this cat or this dog or whoever, whatever, you know, will not leave and will just be scratching at the door or whatever if I don't let them in. And they know that something's going on and they know to stay away at this time or whatever.
He follows me everywhere.
Right, and he's like under your butt, so he would be, you know, he would be like on you, which, you know, I don't see a problem with that. I mean, if I had an animal, I probably
You would just need to have them out while you're hooking up.
While you're hooking up, right. You know, I probably would have them. I mean, I'm not one for animals in my bed to begin with, but I'm in the chair, in the dialysis chair, I would, you know,
to be clear, Peanut does not sleep in our bed.
Oh, no, I wasn't saying that, but yeah. But, I mean, and some people love their animals in their bed. I just don't.
And Peanut weighs 11 pounds. I feel like I should say that because I feel like you don't really get
I think he's lost weight, though. He looks like he only weighs
Well, because I get yelled at when I take him to the vet. They're like,
he was fat.
He's 11 and a half pounds. He really should be under 11. And they're like, okay, well, but he just would eat. Like, if I opened the bowl to his food, he would just eat the entire food. So I give him like 10 kibbles, like
I think I gave
multiple
him too
times
much
a day.
the other day.
So he goes out to he goes to go tinkle. And then I give him like 10 kibbles, and that's it. Like, but I feel bad, but like that's how but now that happens several times a day.
Yeah.
So he is eating enough. He's just not like you can't put out a bowl for him like you would a normal dog because he'll just
because he eats it all. I think I gave him 15 kibbles the other day.
Did you give him? I don't count them. I'm guessing it's about 10
because
kibbles.
I put some in and I said, Anya, is this about you know, as much or is it too much? And she was like, put some back. And so I put some back, and then she said, oh, maybe a little bit more than that.
Oh
so
my
I had
gosh.
to, you know, and it was. And
it's not that serious.
If I had a number, then well, he's so small. But anyway, so yeah, that's where I am today with you know, doing home dialysis and, you know, not loving every minute of it and not going to say I run marathons after, but it's dialysis. Like, it still sucks. Dialysis just sucks. It's no, you know, not a way to live. There's, you know, but there is a quality of life that can be had. Even if you're in center, I'm not saying, because there's many people who are in center who come off just, you know, ready to, you know, start their day and, you know, and that's great. You just find what works for you, I think. And this is what works for me for right now.
So, I have down here that what might be interesting for us to do is we do have a Facebook page up and running.
Oh, yeah.
The Kidney Bean.
Yeah, that's Tiffany did that as well.
Well, it's not professional, so don't be a hater, okay? Yeah. But one thing I would like to know is what is everyone doing while they, and I'm going to try and say this word correctly, dialyze.
Yeah, while they dialyze, not dialysize or whatever people say.
So like the way I had to remember it is I'm thinking like when I pick up my phone, I dial it and I have eyes. So dial eyes. Like I'm a very visual
And these words
person.
are hard, and they're hard for even the patients. And
I want to say dialysize, but that's not the right word.
Yeah, but it doesn't sound as wrong. It doesn't sound that wrong. And
for some reason, dialysize is easier for me to say than dialyze because I feel like I'm missing something. Now I think I've got it down.
Yeah, and I hear nurses say dialysize. You know, what days do you dialysize? So I kind of get it, but it's dialyze.
If someone is out there and they know, like, if they're like the same word or you're saying
if that's not a word at all. I don't know.
Dialysize is not a word.
No, I'm saying or if
is it a word? Is it a word? Because we don't know.
But yeah, that's another thing. And I have a whole, you know,
because you're a podcaster, like you love podcasts.
Oh yeah, I love listening to podcasts. But I have this, I watched a YouTube video, The Words Matter, that I got from a lady who's pretty into all this, you know, on Facebook. And she's always given out really good information.
Right.
I don't think I would even say her name right. It's a German name, but I might give her a shout out eventually because it's always kind of going back to her.
Yeah, we'll figure out how to pronounce it.
I think because it's like NGTELE.
That's a lot of consonants together without a vowel.
It's German, and so it's like, I looked it up and now I can't remember. I'm not even going to try. I don't like to mess up people's names. That's one of the things I really don't like to do. But it always goes back to her. She is the, I guess, creator, moderator, founder, whatever, you know, all of those things for Home Dialyzers United. It's a support group on Facebook, and it's a good one.
And I'm part of that, or I can't remember. I think I am.
I don't know if you're part of that one.
I've been getting into the Facebook groups.
I know. I see your likes on.
I do like
living on dialysis. That's a good one. Then it's new.
No. I think it's such a good thing to have that just for short answers. But I think what would be good is because like for people to tell their stories, to kind of join us, and then we can all kind of share stories.
Well, that's what I'd like and one of the reasons I wanted to do this podcast is because sifting through all of that stuff is difficult, and typing out your responses. And when I'm doing dialysis, which is your question, I have the time to sit there and do that. But then if I get a notification when I'm at work or whatever, and if you're typing out a status, I mean, it's a lot of texting, typing out.
If you type out your entire story, I mean, I would love to read it, but will I read it? I don't know. I want to.
Yeah, and all of us have such a different story. Like, people might think, wow, that's crazy what I just told. There's a million people who have a crazier story than I do, and
we would love to have some people on like that.
Right. Sure. I definitely like to hear people's stories still, and
please interact with our Facebook page, and we are going to put questions on there and really hope to get some responses to see what people do, because
and you can message us.
Also, one thing we did not mention is there are 5 sisters, and 3 of us are guardian ad litem volunteers.
Oh yeah.
So we are the voice for children in the court.
Yeah,
so I know, and I only bring that up because I know when you are doing dialysis, you do a lot of court reports.
Yeah,
so you're there with your laptop, because I do them at night, like when there's no one around to make noise and disturb me.
Yeah, I'm always sending them at like 2 a.m. and I'm sure she's like, what the heck? But I'm a bartender for life. So, it's just...
Well, you're not bartending now, but you're still in that...
I am a little bit. I still go and help out.
I still feel like you're still in that schedule no matter what. And then, of course, Slim's in that schedule too.
Yeah, that schedule's never going to leave me. And so that's what's great about home dialysis, because, I can dialyze like, till 2 in the morning or whatever. I mean, in the beginning, I was supposed to do waking hours because I'm a solo patient.
Right.
I think that they trust me enough now that it's okay if I happen to have to do it like a little bit late.
Well, plus you have support. Night. I mean, there's been times where you've needed something and you've called me, and I'm right down the road, so I come.
Yeah, that was in the beginning. There was, like mishaps that happened, and people will say, what if something happens and this and that? And I'm like, something might happen, I mean, I'm not going to say that it will. It did for me. There were a couple times that, there were scary things that happened, and we had to call EMS, or you guys came over or whatever,
Sometimes I feel like, though, a lot of times it was easier for you just to call us.
Yeah.
Like when I say us, me and Sean, or just me, and then we'd come over, and a lot of times we would be able to fix the problem without calling EMS, because I know like calling EMS for you is like...
Then they want to take you to the hospital, and you might not need to go to the hospital. I have to explain dialysis to them anyway, so why not just do it myself? And I was so... Like, I would get irritated with them because, like the one lady that came in, and she's like, where do you do dialysis? And I'm like, do you not see this stuff right here? Like this machine in the corner of my room? So I was like, right there, and she was like, well, I'm sorry, and so that was, I was frustrated.
That was not very nice.
No, I get mean when I'm frustrated like that. And that's something I've been working on. And, Slim gets embarrassed at the hospital and stuff, but I've definitely been a lot better.
And you have.
It's just, it's a thing.
But also, too, is we can't put ourselves in your shoes and know what it's like to be that frustrated. Right. And not only to be seeing one nurse and be there during their shift, but then they switch shifts, and then you're talking to a whole new nurse, and you have to repeat everything. So it becomes very
monotonous,
repetitious.
Yeah, and it's just annoying that I think I used to be annoyed that medical professionals didn't know about dialysis, but you can't know everything.
How often do they actually?
Yeah, you can't know everything. So now I understand. But being a kid, you think that's what some of these people say, that you think that the medical professional knows everything, or they're gonna, some people don't want to do home dialysis because they'd rather be in the care of the professionals and this and that. But now I've become the professional on for my dialysis. For
yourself.
Yeah. Now I'm the only one who's been sticking myself for 3.5 years. I've had one mini infiltration, which we all
Now what's an infiltration?
Oh, when we hear this word,
does it make everybody like cringe?
Yes, because if you've ever seen someone have a bad infiltration, you remember when my arm used to turn black and blue and get really swollen.
I remember, because the day I got into a car accident and I ended up having to go to the same hospital you were
that
at.
Was funny.
Remember, I was like, well, just take me there because that's the trauma. Like, I flipped my truck.
Right.
And they were like, I somehow managed to just crawl out of it. And they were like, you need to go to the trauma center, which is Wake Med. And I was like, okay. I said, my sister's there anyway.
Yeah.
And you were there. And I remember your arm was just so black.
Now, I will say it always is worse than it looks. I mean, I'm sorry.
It looks worse than it is.
Yeah. But you do have to
it's way worse than it looks. See how it looks? It feels much worse than that.
Terrible. And, I have pictures from over the years and stuff, and people are like, holy.
I think it's funny that your arm will literally be black, right? Like black and purple. And then they still have the sign that says don't use left arm.
Right, like, yeah.
Like, if someone comes in and sees your arm looking like that and is still like, well, let me take some blood.
You'd be surprised. But yeah, so I've only had one teeny tiny one where my arm it was a little bruise, and like I felt it, we call it blowing, the vein blew. Because I was being stupid.
The vein, what happens in that
Okay,
time?
so the needle goes through the fistula. And basically
so it goes into like muscle?
Or whatever.
Whatever's there outside of the fistula.
Yeah, so then your blood is leaking under your skin. And then you have to do like rotate ice and heat for, at least 24 hours.
That sounds like
fun.
Days.
Yeah, it's great. And so, it's this pain. It's this pain that we're all fearful of, that we know it and we don't want to feel it. It's like basically, the needle is in there, but it's kind of, blowing up, and the longer it goes, the worse it gets. So if you're sitting there in center having to this is why you can't move your arm during dialysis. This is why you only have certain people who stick you, because if a new tech or someone who doesn't know what they're doing, or someone who doesn't know your fistula, or whatever.
And you probably sound picky, but it's like I could end up in the hospital if you don't do this correctly.
Right. And so people are, every day in center, nope, she's the only one who can stick me, and they'll wait for that tech. Well, now I don't have to, that's one
You're your tech.
Yeah, that's one of the things that I don't have to worry about. Now, when I did it, when I infiltrated myself just a little bit, I have to, say it was just a little bit.
Did you feel it? Do you know?
Oh, instantly. What it was like I was having problems with the venous pressure. The pressure was like a little bit higher than I wanted. It wasn't alarming or anything, but I just like it at a certain thing. And that's like, the pressure of the blood going through that needle. And it's right there on my iPad that I have, while I'm doing dialysis.
Yeah, so during your home dialysis, you have your iPad that has all the information on it.
Yeah, it's Next Stage has, it's called Next to Me. It's kind
Next
of clever.
To me.
Yeah, it's NX, the number 2.
Because you keep it next to you.
And then me, yeah. And it's got your blood pressures. You log if you have any issues. You log if you have medication that you give yourself. I just finished the iron series I was doing for my low iron.
Yeah, because I remember you talking about how you had a vial of iron.
The vial of iron, yeah, right. And so I do that through the cartridge, through the lines. If I have low iron, it's like a 10 series set. They call it iron series, whatever. But anyway, that
sounds like an awesome show. I want to watch that show, Iron Series.
So I had moved. I went to go move the needle, which is something that you might have to do sometimes.
Was it uncomfortable? Is that why you had to move it?
It was the high pressure.
Okay. And because of the high pressure. Okay.
Yeah, so sometimes I'll put like a gauze under there. Like we have all these little tricks that we learn, and sometimes you'll tape it a certain way for the angle to stay where it needs to be or whatever. And that's another reason I'm having the fistula worked on. But so I went to move it, and I was very stupid about it because I was frustrated, and I just kind of like just went, and I was like, why did I do that without thinking? Instantly, it kind of puffed up, and it was hard. It got hard, like this little knot, and I just felt it. I was like, and I just stopped instantly.
Up.
Yeah, I just stopped instantly and was like.
So what did you do after you realized you did that?
Well, you got to stop, and then I pulled the needle, and I just stopped treatment.
Okay.
There are ways to save it. I think it would probably be better if somebody had been there and I could have had them, like hold this while I'm doing this, because you would have to hold the site for the bleeding for, a few minutes or whatever. Mm-hmm. And then you'd have to do another spot.
Right.
Recannulate.
But at the same time, you have to take care of that's happening too, right?
Right. And by this time you might clot, and I probably would, because like I said, I don't do the heparin. I do saline halfway through to keep my blood from clotting. I give myself a saline bolus is what we call it. And so I just stopped treatment. I think it was.
I remember you talking about how you have to do the saline because once blood is out of your body, it will clot, even if it's kept at a certain temperature. Like you were telling me that, and I thought that was interesting. Because I was thinking, like, if it's constantly moving, like, how does it still clot?
Yeah, and that's the thing with the constantly moving. Like, people debate all the time about the blood pump speed. Mine is 380, which is how fast the blood is going through.
Like 380 measurement.
I don't know. That's something.
It's like, is it like 380 miles an hour? No. God, that's fast.
No, that's something that's so funny because, I said I was an expert on my own dialysis.
No.
There's so many things I still don't know.
But that's the thing. Like, you are a very good expert on it. Like, but there's always going to be things you don't know.
Right. And so that's something I should find out is like what that means. But the lady I was referring to earlier, who's very knowledgeable in all this stuff, she always tells people on Facebook, see if you can run at 300 instead. It's slower. She's like, there's no reason. She says that they don't, there's not been any evidence of a better cleaning at a higher speed.
Okay.
So, some people do up to 450. And I thought it was based on, your weight. I mean, it's obviously your doctor comes up with the prescription.
Does that mean you have a shorter time if you do it at a faster
No.
speed, or what does the speed have to do with anything?
That's a good question. So I thought it was better cleaning, but apparently,
No.
this information that I've, seen.
We
is
would love
not-
to maybe get someone on that would have those
It would be her
answers.
probably, so I would have to. I'm going to
Yeah.
reach out to her anyway. But so the blood pump speed is related to the pressures, like the arterial and the venous pressure, because once I turn my blood pump speed down, the pressure will go down. And so
Like your blood pressure.
No, not blood pressure. The
wait.
venous and the arterial pressures, which is like, okay, so the venous pressure is the pressure of the blood moving through the lines.
Okay.
And the arterial pressure is the arterial pressure of going out, venous coming back in.
Okay.
So I will do that a lot of times. I'll run at 350 or 320 or 300. And I honestly kind of notice that I feel a little less drained sometimes. And that kind of might be a mental thing, but I think
Right.
that also might be a correlation.
Well, I don't know how you don't feel drained because you're
I do.
literally drained.
Yeah,
But-
I do. I do
so-
feel drained. I've always been that way.
We are coming up on close to an hour.
Yeah,
I don't know what it's going to look like edited, but
I know,
we'll see.
I talked
So
so much.
we're going to wrap up things for today for this particular podcast, and we would love to get your feedback. Like I said, we'd like to kind of talk about what you do while you dialysis. No, dang it! I almost did it again. Dialyze.
Yeah.
We really would like to know what you do. Do you like TV shows, podcasts, video games? You just hang out on your phone? What do you do? So
Crochet.
give us some feedback on our Facebook page. And we're going to end by saying our little saying. Do you want to say it together?
I guess so.
Okay, we'll do. Share your spare. I don't know if that came off lame, but thank you so much for joining us today.
Thank you. That was fun.
That was fun.